Watching someone you care about struggle with an eating disorder can feel overwhelming and helpless. You might wonder, what can I actually do to help? The truth is, eating disorders aren't just about food. They're deeply tied to emotional struggles, control, and self-worth. The good news is that with the right approach, your support can make a real difference. But how you help matters, and knowing where to start can be the key to guiding your loved one toward recovery. In this article, we'll dive deep into the nuances of how to help someone with an eating disorder, how to approach sensitive conversations, and ways to support someone's healing journey. Let's face this challenge together with empathy, understanding, and actionable advice. Understanding your loved one's eating disorder. Understanding eating disorders isn't as straightforward as it may seem. It goes far beyond someone simply wanting to be thin or fit into society's image of beauty. At its core, an eating disorder is often a way for someone to cope with deeper emotional pain or distress. According to the American Psychiatric Association, eating disorders affect up to 9% of the population and can be among the most challenging mental health issues to address. When someone you care about is struggling, it's crucial to remember that their behaviors are not simply a choice or a phase they can snap out of. Instead, they may be using food, whether by restricting, binging, or purging as a way to gain control over a chaotic inner world. These disorders can be rooted in trauma, perfectionism, societal pressures, or deep-seated feelings of unworthiness. Empathy is key here. Dr. Jennifer Rowland, an expert in eating disorders, explains your loved one doesn't need a lecture. They need someone who can listen without judgment. It's a reminder that being a compassionate, understanding presence can be the most powerful tool you have to help them start healing. Types of eating disorders to recognize. Not all eating disorders look the same. They manifest in different forms, each with unique symptoms and struggles. Here are some of the most common types to be aware of. Anorexia nervosa. This disorder involves extreme restriction of food intake, often paired with an intense fear of gaining weight. Individuals may see themselves as overweight even when they're dangerously underweight. The psychological need for control is often a driving force behind anorexia. Bulimia nervosa. Those with bulimia engage in cycles of binge eating followed by purging, whether through vomiting, excessive exercise, or laxative use. The disorder often stems from feelings of shame and self-hate after consuming large amounts of food. Binge eating disorder. Unlike bulimia, binge eating disorder does not involve purging. People with this disorder consume large quantities of food in a short period, often eating to the point of physical discomfort. It's usually accompanied by feelings of guilt and loss of control. Avoidance/restrictive food intake disorder. This condition is characterized by a severe limitation in the types or amount of food someone is willing to eat. It's not necessarily related to body image concerns, but may stem from past trauma or sensory issues with food textures and smells. Myths versus facts about eating disorders. When it comes to eating disorders, misconceptions abound. Let's bust a few common myths. Myth: eating disorders are just about food or vanity. Fact: while food is involved, eating disorders are rarely about wanting to look good. They're coping mechanisms for deeper emotional or psychological pain. Myth: only teenage girls suffer from eating disorders. Fact: eating disorders can affect anyone, regardless of age, gender, or background. In fact, about 25% of those with anorexia or bulimia are male, according to the National Eating Disorders Association. Myth: you can tell if someone has an eating disorder just by looking at them. Fact: many people with eating disorders appear to be at a healthy weight or may even be overweight. It's not always about being dangerously thin. Emotional distress often lies hidden beneath a seemingly normal exterior. Warning signs that indicate an eating disorder. Recognizing the warning signs early can make all the difference in getting someone the help they need. Eating disorders are often secretive in nature, making it hard to know if someone is struggling. However, there are red flags to watch for. Restricting food and extreme dieting. Restricting food is one of the most common, yet easily hidden, behaviors linked to eating disorders like anorexia. It often starts innocently, a diet for health reasons or a desire to lose a few pounds. but over time, it can spiral into an obsessive need to control food intake. You might notice your loved one becoming increasingly rigid about what they eat, categorizing foods as good or bad, or even eliminating entire food groups. Extreme dieting isn't just about eating less, it can also mean skipping meals, claiming to have already eaten, or engaging in ritualistic behaviors like cutting food into tiny pieces or pushing it around the plate to appear as though they've eaten more. This isn't simply a matter of willpower, it's a sign of a deeper psychological struggle for control. As Dr. Laura Hill, a prominent expert on eating disorders, puts it, the more someone restricts, the more the brain reinforces the need to continue this behavior, even to the point of self-destruction. Binge eating behaviors. When we think of binging, it's easy to dismiss it as just overeating. But binge eating disorder, BED, is much more than that. It's characterized by consuming large quantities of food rapidly, often to the point of discomfort. What's crucial here is the intense feeling of shame and guilt that follows, leaving the person caught in a cycle of emotional distress. You might notice hidden food wrappers, secret stashes, or a reluctance to eat in front of others. Binge eating often happens in isolation, away from the judgmental eyes of others, which perpetuates the cycle of secrecy. It's driven by the need to fill an emotional void, not by hunger. According to research published in the Journal of Eating Disorders, many individuals with BED struggle with feelings of inadequacy and low self-esteem, using food to numb the pain. Purging and its consequences. Purging behaviors go beyond just self-induced vomiting. It can include the misuse of laxatives, diuretics, or engaging in excessive exercise to undo the calories consumed. For many, purging feels like a twisted form of relief, but it comes with serious health risks, from electrolyte imbalances to long-term damage to the digestive system and heart. Purging is often driven by intense guilt after eating. The compulsion to get rid of what they've consumed can be overwhelming, turning meals into something to fear. Physical signs like swollen cheeks, broken blood vessels in the eyes, or even decayed teeth can be telltale indicators of frequent vomiting. The long-term effects are severe and often require medical intervention. Body image issues and self-perception. It's not just about food. At the heart of many eating disorders lies a distorted body image. The person may perceive themselves as overweight even when they are underweight. This skewed self-perception can make it difficult for them to see the real damage they are doing to their body. It's a bit like looking in a funhouse mirror. What they see and what's real are worlds apart. Comments like, "I just need to lose a bit more weight," or "I'll be happy when I'm thinner," often reveal the underlying dissatisfaction with their self-worth, which they've tied to their physical appearance. This obsession can turn into a relentless pursuit of an unattainable ideal. Psychologist Carol Dweck, in her book, Mindset, discusses how perfectionism and fixed mindsets can drive individuals to extremes, particularly when their self-worth is linked to appearance. Recognizing this distorted thinking is key to helping them find healthier coping mechanisms. Concerned for someone? Start a conversation. One of the most challenging things is knowing when and how to step in when you suspect someone you care about is struggling with an eating disorder. We worry about saying the wrong thing, pushing them away, or even making things worse. But staying silent isn't the answer. Your concern could be the catalyst that encourages them to seek the help they desperately need. Timing matters. Choose a quiet, private moment when emotions aren't already running high. Your tone should be gentle and non-confrontational. Try starting with something like, "I've noticed you seem stressed lately, and I'm worried about you." Make it about your concern for their well-being rather than focusing solely on their eating habits. Remember, they might not be ready to open up right away. They could react defensively or deny there's a problem at all. That's okay. The goal of the first conversation isn't to fix everything, but to show them that you're here, willing to listen without judgment. How to approach talking about an eating disorder. Conversations about eating disorders require sensitivity. This isn't the time for tough love or pushing them into action. Instead, focus on being a compassionate, understanding listener. Acknowledge their feelings, even if you don't fully understand them. Often, people with eating disorders are dealing with intense shame and fear. Your support can make them feel less alone in their struggles. Avoid making it about appearance. Instead, frame your concerns around their health and happiness. For instance, saying, "I've noticed you seem tired and withdrawn," is likely more effective than "you're looking too thin." This shifts the focus away from their body and onto their overall well-being. Psychologist Dr. Thomas Joyner emphasizes the importance of using "I" statements to express your concerns. For example, "I feel worried when I see you skipping meals" is less accusatory and more about your genuine concern. It opens the door for dialogue rather than putting them on the defensive. What you should avoid saying. It's easy to put our foot in our mouth when discussing sensitive topics, even with the best intentions. Here's what to avoid. "Just eat more. It's not that hard." This statement might seem logical, but it completely misses the point. Eating disorders are not simply about food. They are deeply tied to emotional pain and control. "You look so much better now." While you might think this is encouraging, it can actually reinforce the idea that their worth is tied to their appearance. Compliments on weight gain or loss can be triggering. "I wish I had your willpower." This can sound like praise, but to someone struggling, it reinforces unhealthy behaviors. It's better to focus on their strength in facing their challenges rather than their ability to restrict food. Encouraging professional help. At some point, your loved one will need more than just your support. Eating disorders are complex, requiring the expertise of professionals like therapists, dietitians, and sometimes even medical doctors. But getting someone to take that step can feel like walking on eggshells. How do you convince them without making them feel forced? Start by normalizing therapy and treatment. Share that seeking help isn't a sign of weakness, but an act of courage. It's okay to acknowledge that therapy can feel intimidating, but it's the best path toward a healthier, happier life. Mention that you're willing to help them find the right support, whether that means researching therapists or accompanying them to their first appointment. It's also helpful to highlight the benefits of therapy beyond the eating disorder itself. Many people are more willing to seek help if they understand it can also address anxiety, depression, or self-esteem issues they may be struggling with. Sometimes, framing it as a way to improve their overall quality of life can shift the conversation in a more positive direction. Remember, this is a journey. They may not be ready to seek professional help right away, and that's okay. Your role is to keep the door open, continue to express your support, and remind them that they don't have to face this alone. As Brené Brown wisely says, empathy is not connecting to an experience, it's connecting to the emotions that underpin an experience. Your understanding and patience can be the beacon they need in their darkest moments. Effective treatments for eating disorders. Treating eating disorders isn't a one-size-fits-all approach. The most effective strategies often involve a combination of therapies, medical treatment, and nutritional counseling. Recovery is a journey that requires time, patience, and often professional intervention. The earlier someone starts treatment, the better their chances of overcoming the disorder. The goal of treatment is to address not just the eating behaviors, but also the underlying emotional and psychological issues driving them. This means digging deep into feelings of inadequacy, trauma, anxiety, or control that may have sparked the eating disorder in the first place. According to the National Institute of Mental Health, a multidisciplinary approach that includes mental health professionals, dietitians, and medical doctors is often necessary for successful recovery. Different types of therapy for eating disorders. Cognitive behavioral therapy, CBT. This is one of the most common therapies used to treat eating disorders. CBT helps individuals challenge and change distorted beliefs about food, body image, and self-worth. It focuses on altering negative thought patterns that drive disordered eating behaviors. Studies have shown that CBT can be highly effective, particularly for bulimia and binge eating disorder. Dialectical behavior therapy, DBT, is especially beneficial for those who struggle with emotional regulation, which is often linked to eating disorders. It teaches coping skills to handle intense emotions, reduce self-destructive behaviors, and improve interpersonal relationships. The mindfulness techniques in DBT can be especially grounding for individuals who feel out of control. Family-based therapy, FBT, also known as the Maudsley approach. This therapy involves family members in the treatment process, especially when it comes to younger individuals. The family takes an active role in helping their loved one regain control over their eating patterns. FET focuses on creating a supportive environment to foster recovery. Nutrition counseling, working with a dietitian who specializes in eating disorders, can help individuals rebuild a healthy relationship with food. It's about more than just meal planning. It's learning to listen to one's body, understanding nutritional needs, and overcoming food-related fears. Managing eating disorders at home. Home is where the heart is, and for someone recovering from an eating disorder, it's also where they need the most support. The environment you create can either aid their healing or unknowingly trigger setbacks. This doesn't mean walking on eggshells, but it does mean being mindful of how you talk about food, weight, or appearance. Avoid having a scale prominently displayed or making comments about your own diet. Instead, focus on creating a positive and inclusive atmosphere around food. Encourage family meals where the emphasis is on connection rather than calories. This can be a great way to normalize eating patterns without putting pressure on them. It's also important to establish trust. Let your loved one set the pace of their recovery. Some days will be harder than others, and that's okay. Be their safe space. Encourage self-care practices like journaling, gentle exercise that isn't fixated on burning calories, and creative outlets that help them process their emotions. How to support recovery long-term. Supporting someone through the long haul of recovery can be both rewarding and exhausting. It's a marathon, not a sprint, and there will be setbacks. But remember, every small victory counts. Relapses may happen, but they don't mean failure. It's just part of the process. Keep communication lines open. Ask how you can help and listen to what they need. Sometimes it's just being there, without trying to fix them, that makes the most difference. Encourage them to continue therapy even after they feel better, as it helps solidify the coping skills they've learned. Celebrate progress in non-food-related ways. Maybe it's a trip to the beach, a hike, or simply spending time together doing something they love. Recognizing the small wins can build their confidence and reinforce the positive changes they've made. Most importantly, take care of yourself, too. Supporting someone with an eating disorder can be emotionally taxing, and you need to recharge your own mental health to be the best support you can be. Don't hesitate to seek counseling or join support groups where you can share your experiences with others in similar situations.